Hi guys, welcome to Plastic Surgery Education. So today we will be discussing about syndactyly. Syndactyly is fused digits, fused fingers. So syndactyly is one of the most common congenital differences of the limbs, of the upper extremities mainly. And the incidence varies from, I would say, 1 in 2000 to 3000 children have a likelihood of having syndactylies. So I'll try to address some of the most common queries which parents of patients or parents of children with syndactylies tend to have. So why does my baby have syndactyly? Now syndactyly is something which is transmitted genetically. It is hereditary in many cases. In some cases, it might be part of a syndrome wherein there are multiple congenital differences which are there in that particular baby, and syndactyly is also one of those components of that syndrome. Uh, is it only limited to digits or there might be other anomalies? So there is likelihood that there might be other congenital anomalies, other congenital differences. So eventually we should rule out those by various investigations, by various scans. How is syndactyly diagnosed? Syndactyly is essentially a clinical diagnosis. On clinical evaluation of the particular extremity of the hand, we can confirm the diagnosis of syndactyly. Further investigations like X-rays are necessary in cases where there might be more complicated type of syndactylies involved. But more commonly, X-rays are also performed in addition to clinical evaluation so as to give us a definite picture of what is the extent of the syndactyly. Now coming to whether it is life-threatening, whether it is painful. So syndactyly individually per se as a isolated difference, as an isolated congenital difference is neither painful nor it is life-threatening. If it might be associated with some other congenital anomalies, then that is a different issue. Does it need surgery? Yes. Syndactyly for optimal aesthetics and proper function definitely needs surgery. In very rare cases, the central digits, if there is syndactyly of these two fingers, we do tend to get patients who have reached adulthood without operating on that particular syndactyly, and they don't have any functional deficits as such. But syndactylies of border digits, that is between the index finger and the thumb, or little finger and the ring finger, these syndactylies need to be operated because what happens is the digit which is shorter in length, for example, here the little finger is shorter as compared to the ring finger, and what happens is that during the growth, since they are both joined, the growth of this finger is restricted. It might lead to crumpling of these fingers and functional disabilities in the longer run. So what is the age wherein this surgery needs to be performed? Now the surgery, we can perform the surgery anywhere between around 4 months of age to 12 to 18 months of age. Now, as I just said, the border digits need to be aggressively approached. They need to be operated early on before some bony deformities develop. Otherwise, we can safely operate the central syndactylies without any digital discrepancies at around 1 year of age. Again, if the patient presents late, we can obviously operate at the age when the patient presents to us. So what if I don't operate? As I just said, if it is a syndactyly between two digits of central digits wherein there is not much of a discrepancy, it probably won't even matter. In the long run, patients do tend to behave well, do tend to have good function, but again the aesthetics are hampered, so it is better to operate these patients. Are there any risks of surgery? Yes, there are a couple of risks which are involved with all type of surgeries. There are risks associated with anesthesia and risks associated with surgery proper. We will discuss just about the risks associated with surgery proper. There might be a risk of damage to the nerves, damage to the vessels, because these digits have got congenital differences. So there might be differences in the blood vessels as well as nerves, so which are at increased risk of damage as compared to normal digits. Then there are chances that the syndactyly might recur to some extent. If the fused digits are separated, they don't tend to again fuse back, but there is something called as web creep, wherein the web space tend to creep ahead, and it gives a sort of apparent feeling that part of the digit has again fused after the surgery. So in those cases, we might need to go in and do a revision surgery in due course of time. I would say roughly around 5 to 10% of the patients might need revision surgeries in due course of the syndactyly, even after release. So will the function get back to normal after syndactyly release? Almost always the function tends to get back to normal. It again depends upon the complexity of the syndactyly. If it is a simple syndactyly without bony fusion, the function almost always nearly gets back to normal. If there are bony deformities, if they are not addressed on time, if some joint deformities develop in due course of time, then it would be difficult to predict. But yes, the function would definitely be much more better than what it might have been if the syndactyly is not operated. Then there are many syndactylies wherein we have all the fingers fused together like this. So in these cases, what many parents expect is that all these fingers should be separated and we have a normal 5-digit hand. But in many cases, it is not realistically possible, because there are again anomalies with the joints, the carpals, the metacarpals, and the phalanges. So in these cases, our aim is to give a functional hand and not a simple aesthetic hand and try and separate all the 5 digits. So it all depends upon the radiological manifestations and the clinical examination. Our end result, our goal of surgery is to give a functional hand to the baby, wherein the baby will be able to do activities of daily living with the affected extremity. So it is not our goal to separate all the 5 digits together in complicated cases. We want to give a functional hand. Will it look normal? In simple syndactylies, it looks almost always near normal, but in complicated syndactylies, it doesn't actually look like a normal hand, but yes, it tends to look better than what it was before. Then what if I have syndactyly of the toes? So in many cases, syndactylies are bilateral, involving both the hands. In some cases, it also involves the toes. In those cases, the syndactyly of toes can also be released. From a functional point of view, the syndactyly of the first web space of the toe, that is between the great toe and the first toe of the legs, is very important, because that helps us in wearing slippers. So that is important from functional point of view. Otherwise, most of the other syndactylies, if they are involved, is from more of a aesthetic point of view. So what actually is done in the procedure is that we mark specifically flaps which are designed for syndactyly release, and then the fingers are separated. Wherever we have raw areas, there might be a likelihood that we need to have some skin graft taken from either the thigh or the groin or from any other region, and that is applied over the raw areas. Dressing continues for a few days, maybe a few weeks, till the raw areas have healed. Then there is splintage which is provided to the patient. We don't want recontractures, resyndactylization. So we need to provide some sort of a support, some sort of a splintage to the patient, which minimizes the risk of recurrence. So that is provided to the patient. And Physiotherapy is initiated as early as around 2 to 3 weeks as soon as the wounds have healed, and the patient, we try to take back the patient to activities of daily living, functional object holding, active and passive physiotherapy, and so on and so forth, depending upon the individual requirement of the patient. So I think these were the common queries related to Syndactyly which patients or other parents of kids with Syndactyly tend to have. So it is not a life-threatening condition. Patients do tend to behave very well after Syndactyly release. So if you or anyone you know does have Syndactyly, please refer them to a plastic surgeon so that the Syndactyly can be adequately and appropriately addressed. Thank you. Take care. Cheers.